Thank you very much at magandang araw mga kaibigan. Nagbabalik po ang inyong programa ng Aksyon Central Luzon Special Edition. Ito po si Sunny Lopez at ngayon po sa ika-8 taong anibersaryo po ng ating pong programa, no, ay meron po tayong mga special series. Pero itong medical series po natin, hindi special na in the sense na ngayon lamang gagawin. Matagal na ho namin ginagawa ito ni Doktora at maganda po ang feedback, maraming natutulungan. At marami rin ho nagre-request na ma-replay ang mga ginagawa namin, mga interviews with several practitioners na iba-iba ho ang specialization. But that is going ahead of the story. I'd like to introduce my co-host and kasama ho sa Angeles Medical Society, si Dr. Rowie Medina.
Hello, Central Luzon. Thank you for having us. And we're going to bring the doctors to your home. And please stay tuned and watch us. We're here with an eye doctor. The topic for today is about lasik, and hope you will enjoy this one and learn from this.
I just would like to add, no, before I will introduce our special guest today. Ito ho kung si doktor na to, kasama ko ito nung nagra-radyo pa lang ako nung nasa taas pa ho ng building yung GV noon, mga kaibigan, no? Ano siya noon? Residente pa lang. Pero pinag-uusapan na namin itong topic na to, but this is something that is close to me because ako nagkaroon ng problema sa mata, nagpa-LASIK surgery ako. At ang mata ho ay isa sa pinakamahalaga pong organ, no, ng tao na nagagamit po natin sa pang-araw-araw lagi. Kaya po nandito po si Dr. Andrew Angeles.
Thank you, Sunny. Thank you, Rowie, for inviting me here at your show.
Actually, Dr. Andrew Angeles is a consultant at Angeles University Foundation. Had his subspecialty in cornea and refractive surgery at University of Southern California in Los Angeles. He's a diplomate and a fellow in ophthalmology. Finished his master's in business administration at Ateneo de Manila University. So, Doc Andrew. That's what his friends call him. So we'll start with ano ba yung most common laser vision correction? Ano ba yung we've heard about nearsighted, farsighted, astigmatism. So can you elaborate on this, explain on this one?
Kasi meron tayong nearsighted, farsighted, and astigmatism. Okay? These are what we call as refractive errors. So,
ako nearsighted ako dito.
Yeah, nearsighted ka. No? There are people who are born na maliwanag yung near nila, but the distance is malabo. Those are nearsighted. Yung farsighted can see a little bit at distance, but blurred sila sa near. Okay, those are farsighted. And sometimes, kung mataas yung pagka-farsighted mo, even for distance, malabo pa rin. No? And then we have astigmatism. Astigmatism, yung eyeball is supposed to be round shape, no? Sa astigmatism, medyo oval siya, parang football. So, yung image, kasi ang mata, it's like a camera, no? Meron kang lens, no? Yung image napupunta sa lens, tapos meron kang film, which is your retina, okay? Kung yung cornea mo, which is the, kumbaga, pinaka-window ng mata, is it's usually dome shape yon. Okay? Pag nearsighted, it's slightly cone shape. Okay? So yung image does not focus dun sa film, which is the retina. So ang umaabot sa retina that picks up to your brain is blurred siya. So pag farsighted ka naman, medyo flat yung cornea mo. So yung image mo is focused at the back of the retina. So blurred din yung same thing with astigmatism. Hindi sila nakafocus sa retina.
Puro problema yan, ha?
Kaya blurred vision.
Pero pwedeng combination?
Ano?
Pwede bang combination? Parang nearsighted, tapos may astigmatism
usually, nearsighted ka, yung iba, nearsighted, plus meron silang
astigmatism, right?
Yung ibang farsighted, meron din silang astigmatism.
Combination ng konting.
Is that the reason why the eyeglasses? Merong nakapormang ganon?
Yeah. With the eyeglasses, it corrects. Kung nearsighted ka, merong glasses na for nearsighted. meron ding glasses na combinations of nearsighted at saka astigmatism.
Stigmatism.
And we're not talking about just age na medyo pag 40 years old and above,
Yeah.
doon ka palang malabo ang mata, right? Even children,
Yes.
Yeah.
meron ka agad.
Yeah.
Sabi mo nga, malabo na kaagad ang
Are you born with it? Is it genetic? Or?
Meron tayong presbyopia, yung sinasabi mo. But usually with nearsighted, farsighted, and astigmatism, you were born with that. Or
Okay.
as you get older, yung eyeball shape mo is, kumbaga, nag-iiba yung shape. So, nag-iiba yung grado mo. Okay? But usually, meron ka ng inherent na nearsighted o farsighted.
So, nung
Okay.
una, sabi nila, basta maaga kang magsasalamin, kung maaga kang nagpunta sa doktor, sa mga ophthalmologist,
Kinorect yun.
makukorek yan. Is that a correct,
Hindi siya totoo
accurate?
yan.
Oh,
No, it's
okay.
not an accurate. So, kahit na at a young age, kinorek na with glasses yung salamin mo, kung tataas, tataas pa rin yan. Okay? Meron naman certain people na bumababa, bababa pa rin yan. Irregardless kung nagsasalamin ka or not. It's not really yung nagsalamin ka. Yung iba naman, the opposite yung alam, no? Pag
Oh.
nagsalamin ka, tataas daw yung
Ako,
grado mo.
every year, tumataas nung nagsasalamin ako.
So, it's not because of the glasses. It's because na talagang ganun yung shape ng mata mo. And as you get older,
It's a process
it becomes longer yung eyeball mo. And then you become more nearsighted.
Is it activity related? Like you read a lot or you
Majority of it is actually inherent, inborn. No?
Okay.
No? So, even though you don't read, ano pa rin, nearsighted ka pa rin. Especially yun, 700 yung grado mo.
Oh.
But there are, sinasabi nila, sometimes there are more tendency for people who read close
Read a lot.
to become more nearsighted than other. But like, hindi naman naabot sa 700. Sabi nila, there's also a parang external factor na nagiging nearsighted ka kung bata pa, mahilig ka magbasa. But I'm not saying
O yung pagka-abuso.
I'm not saying na
baka hindi na sila
magiging
magbasa,
nearsighted ka or something.
But
No,
with the
no, it's not.
advent of television,
Yeah.
internet, computers,
oh, right.
PSP,
Yeah.
you know, these kids are using their eyes a lot
A
more
lot more.
compared to children before.
Actually,
So,
the
factor
computers,
ba yun?
the computers, yun nga, games, no, they won't cause permanent damage to your eye. Same as TV. Ang TV was never banned because it was not really proven na it would
It can
cause
damage
Pag
the
malapit.
permanent
Oo.
damage to your eye. Okay, minsan nagkaka-eye strain ka, no, napapagod yung mata mo sa kakapalit ng TV, but after resting, babalik naman siya sa dati.
kung
with
paulit-ulit
computer.
mong ginagawa yan, abuso araw-araw, sobrang basa, sobrang TV, sobrang computer, hindi pa rin ano yan?
Walang magkakos na permanent damage.
Okay.
Pero sinasabi lang nila, medyo magiging nearsighted kang konti, no? But it's not for everybody. No? Certain number of people lang na nagiging nearsighted. It doesn't mean na mahilig ka magbasa or ano. For sure, magsasalamin ka. Hindi.
O kung mali yung ginawa mo, merong mga salamin na may grado, tapos ginagamit mo, ito, susunod ba yung grado mo doon?
Usually hindi. Ang magkakaroon ka na, magkaka-eye strain ka.
Okay.
So, tendency mo, yung mata mo would try to adapt dun sa vision. No, nagsalamin ka, tapos blurred naman siya. Siyempre, yung mata mo would try to focus.
So, most common is headache.
And eventually,
They can
magkakaroon
have
ka headache, mapapagod yung mata mo.
Dizzy.
Same as having a shoe na hindi fit sa'yo. No? You can wear it, pero after walking for a long time, sasakit yung paa mo. Same thing with the eyes. Kung sinuot mo yung salamin, hindi mo kagrado, siguro for a while, nakikita mong ganun, pero kung meron siyang mali, eventually, mapapagod ka agad yung mata mo of prolonged use.
Pero more young children now, you will notice. Kasi nung una, ayaw nila magsalamin. Pero ngayon, mas marami na nakasalamin.
Yeah.
Ano ba yan? Is it part of yung sinabi nga ni doktora kanya, may relasyon ba? O,
Yeah.
Kasi napapansin ko, marami na nakasalamin ngayon. O kaya yung gumaganon pag nasa...
One thing, people are more aware. Okay?
Oh.
Parents are more aware.
Okay.
No, alam nila, makikita na yung bata, mahilig pag nagbabasa, malapit, no?
Or
nag-TV,
even in school,
malapit.
they have
Yeah.
low grades.
Yeah.
Kasi minsan hindi nila nababasa, hindi sila nakaka-cope up.
Unlike before, meron akong mga patients na high school na nung nagsalamin. Kasi they were not detected early. Okay? So ngayon, yung mga bata, mas aware yung mga tao na, uy, kailangan naman sila kasi malapit Before, kasi hindi naman magko-complain sa'yo yung bata na malabo yung nakikita ko. Kasi hindi naman niya ma-compare yung nakikita mo doon sa nakikita niya. Pero once na yung parents na, or yung mga teachers na notice nila na malapit siyang magbasa, or yun nga, yung grades niya
So they should be more sensitive. Teachers,
And the
parents.
parents.
Kaya, siguro it's more on that rather than yung mas yung mga-
Overused.
yung overused, so mas marami nagsasalamin.
So yung awareness,
Awareness.
is
Which is very
helping.
important. Yeah.
Kasi pag napabayaan naman yan, nagde-deteriorate ba yung ano mo? Pag meron ka ng grado tapos napapabayaan, di ka nagsasalamin, you don't go to your doctor, magde-deteriorate ba yung condition ng eye mo?
Kung magde-deteriorate yan, magde-deteriorate talaga, irregardless kung nagsasalamin ka or not. Ang magiging factor lang siguro, of course, if you don't see well, you won't function well. Like sa school, hindi ka
Some schools, sa clinics nila, merong mga, di ba? Merong mga yung yung chart, di ba? Ako minsan, nung bata ako, grade 4 ako, may grado na ako eh. Dinaanan ko tapos na-memorize ko lahat. So, anong tinatanong sa akin,
Sinasabi mo because of
alam ko.
retention memory.
Pero nakakatulong ba yon? Yung mga charts na yun?
Yeah, but
That's
now
really
we have a
the
charts that's projector charts. We can change yung mga numbers. So hindi na nila basta ma-memorize. Kasi syempre pag binasa niya, you're thinking na
Isa lang kasi sa eskwela
na
namin.
hindi nila anong tawag dito na nakikita niya. You're assuming that but now we have projector charts. Medyo high-tech na tayo na nakikita natin kung change natin.
At what age na? Kasi yung sabi nga natin, magpatingin, nagpapa-check up, di ba? At what age na kailangan yung mga magulang, whether meron silang nakikita o walang kondisyon na napapansin sa kanilang mga anak.
Should see an eye doctor.
Oo, ganun.
Para sa akin, once na yung bata marunong na magbasa ng letters, check mo na.
It's a must, no?
It's just
I think all kids should have their eyes checked. Basta nagbabasa na siyang letters, kahit na mga 2-3 years old siya. Kasi once na matetest na
Just
namin
for
siya
screening,
for distance, malalaman mo na kung nakakakita siya or not.
Screening lang, right? So you should recommend a certain age that children should be screened for an eye.
Oh,
I
you screen
think in
that.
the States, what they do is children as a certain grade, they would go to the school and then all of them will be screened.
Yeah.
Yung eyes
Yeah.
nila.
Siguro.
But we don't do that here.
Yeah.
We don't do that here.
Hindi mandatory, no?
No. In the States, they do that. They do that.
I think
sila.
it should.
You should. I think the
yeah.
of the board should do
Tama.
that.
Palagay
And
ko,
then,
you have to push.
Yeah.
Ako kasi, I suffered eh.
Maybe
Ako-
you, the OFTA here can do a mission or medical mission. Go to school.
The schools.
You
Actually,
get the eye.
we can also join with optometrists.
Yeah.
Kasi optometrists also, they're the one who also refracts. And marami sila kasi sa amin, ophthalmologists.
I saw
so,
one.
we can combine and do a project like that.
I saw them. They go to schools and then they would check the vision of the children. I think grade 5 or grade 4, mga ganon. And then the spectacles, yun yung eyeglasses, di ba? And it could be corrected or with the contact lenses. So, sino dapat ang nagko-contact lens and sino dapat ang nagsispectacles? Kasi yung ibang bata pa lang.
Oo.
Kasi namamaga yung eyes nila, di ba? Kapag masyado ka nang matagal gumagamit ng eyeglasses. So, yung iba, gusto na nila mag-contact lens yung mga bata. So, kailan sila pwedeng mag-contact lens?
Usually, pag bata talaga, 4, 5, 7 years old, 10 years old, usually glasses yan. No? It's the safest, it's the simplest thing to do. No? Para sa akin, I would recommend contact lens once na yung bata would be responsible enough to
Wash it,
wash
clean it before.
Kasi
May
there's
responsibilidad yan.
Yung contact lens, you have to clean it.
Sterilize.
Dapat di mo pinantutulog, you don't abuse it, okay? Once na alam mo yung bata na medyo responsible, pwede na yon, no? Pero kung bata pa siya tas hindi niya gagawin yon, you would have more problems than yung benefit. Kasi kung hindi nililinis, you could have eye infection.
Oo.
So, hindi talaga dapat pinatutulog ang contact lenses?
Usually ako, I don't recommend
Saka
it.
magasgas, di ba?
Yeah, pag nagasgas yung cornea mo, tapos marami yung contact lens mo, may infect yung cornea mo.
Oh, let me ask this, no? Yung kasi marami rin mga batang babae ngayon, di ba? Hindi naman nila kailangan para magkakulay yung mata nila. May blue dyan, may brown dyan.
Yeah.
Tama ba yun? Kung hindi nila kailangan?
Actually, personally, of course, ito naman
Saka nabibili lang doon sa
siguro
tapat ng-
kung I've seen a lot of patients who got blind because of that. Okay? these are people na bibili sila, tapos gagamitin nila, no?
Pampaganda.
And then, papaganda lang, no? Which is, nakakaganda nga naman. Pero minsan, there are certain people na, yun nga, hindi sila responsible. Like, yung iba, sinishare pa nila. Okay? Sinishare nila sa friends nila.
And it's body
Hindi nila
fluids. May
nililinis.
body fluids yun. It shouldn't be done.
That's when problems comes in, no? Nagkaka-corneal infection, nagkaka-corneal scar. And there are some people na the scar is permanent, okay? Na nagka-cause. Ako kasi, it really depends kung talagang gano'n siya gusto. But the risk for me, it's, especially I'm a corneal specialist. They are, yung mga nagka-corneal ulcer from those contact lenses are all being referred to me. And then, when I see them, tapos hindi na, it's just for cosmetic reason, parang sa akin, it might not be worth it. For me,
It's definitely not worth
for
it.
me.
Para sa amin din. Sasabihin na namin, ito kasi mahihayin ito eh. Sabi, hindi dapat.
Hindi dapat.
Hindi
oo.
Hindi, para sa audience natin, lalong-lalo yung mga babae, may itsura na nagpapaganda pa para maging blue yung mata nila. Naririnig yung sinasabi ni
Yeah.
Doktor, ha? Merong peligro yan, ha? May
Yeah.
danger. Losing your eyesight. Di ba danger yon?
Siguro, if you have seen my patients, you would not wear them. Okay?
Ako, buti na lang.
So ngayon, sino naman ang pwedeng, kasi kung hindi ka na pwede or galing ka na sa eyeglasses, tapos galing ka na rin sa contact lenses, and you want something more permanent, di ba meron naman pwede?
Yeah.
Or yung iba kasi gusto nila, storbo sa trabaho na naglalagay ng contact lenses or nag-eyeglasses ka. So, anong pwedeng gawin?
The next option, kasi after glasses, after contact lens, the next step is LASIK. No? It's something na, gagawin mo sa mata mo, and you don't need to wear glasses or contact lens no, after. So, medyo maintenance-free siya, as in, pagising mong ganon, hindi mo nahahanapin yung contact lens mo or yung salamin mo to wear it.
Oo,
And then,
sinusot ko, hinahanap ko eh, nung nakasalamin ako. Hindi biro to, ha?
Yeah.
Because I got so used to it,
Yeah.
I wake up, I get mad. Saan yung salamin ko? Ganyan. Suot-suot ko pala, nakatulugan ko. Sabi kasi nila sa akin, when you wear the glasses for such a long time, it becomes part of you na.
Yeah.
Parang crutches.
Yeah.
Without the crutches, you won't you won't be doing your things normally.
And it's also habit. After mo na LASIK, yung mga ibang patients ko, right after LASIK, nahanap nila yung salamin na, tapos kita ko naman pala, sabi nila gano'n.
Muscle memory yun.
Gano'n, no? Muscle memory yun. Maraming gano'n. No, pag nagda-drive sila, ginagano nila yung, tapos na-realize nila, wala pala sila salamin. So, yung mga patients na gano'n. Of course, muscle memory. Pero, of course, yung mga na-LASIK are usually happy na they don't need to wear yung salamin. Or,
I want to add, no? Kaya ho namin dinidiscuss to, lalong-lalo na sa kabataan. Kasi yung bata, pag hindi ho pinatingnan sa doktor, sa ophthalmologist, no? Apektado yung pag-aaral niya, di ba? Pag meron palang diferensya sa mata, hindi ho natin pinapatingnan, apektado yung mata niya, yung potentials niya as an athlete, as a performer, apektado rin.
And
Because
in school,
I joined basketball tournaments, karate tournaments. Nagsasign pa ako ng waiver noon kasi nakasalamin ako. Nung hindi pa ako naka-contact lens at saka hindi pa ako nagpa-LASIK. So, pati sa ROTC, mga military training noon, pag sumobra, military school, hindi kayo pwede pag yung sobra na sa 500, yung grado mo.
Actually, yeah. Yung mga ibang PNP ngayon, they come to us for LASIK because hindi sila, sometimes, they are
Rejected.
graduates with high grades, lahat, pero dahil dun sa grado nila, they're rejected. But we correct them with LASIK, and then,
Pwede na. Normal na sila nun. Okay.
Tapos babalik na sila sa clinic namin, naka-uniform na sila military.
Mas
Sila
gwapo na
tanggap
sila.
na sila. Oo.
Tsaka lugi kami noon. Ako, nagsasalamin ako kahit sa beach.
Oo. Hindi ka makakapag-shades.
Hindi ko nakikita yung
Yun
mga
yung
kasama ko.
isang dream ng mga matataas ang grado. Yung
Where-
makapag-suot ng shades. Kasi yung
Nag-shades
kung
ako,
shades
makapal
ka,
na yung isa.
hindi mo kita yung
Malabo ang
Especially yung mga shades na curved na gano'n.
Tama.
Hindi mo pwedeng lagyan ng grado yon.
Makikita ng merong bulge dyan, di ba? Sa
Oo.
side.
So hindi mo sila, so ang tendency, hindi sila makakapagsuot ng gano'n.
Oo.
And even kids in school, sometimes they would come home, hindi tapos ang assignment.
Oh, yun.
Kasi hindi niya nabasa. So, hindi niya natapos. So, syempre, pag uwi niya, pagbalik niya sa school, mababa ang grades niya. Di ba?
So these are children that should see an optometrist or an ophthalmologist.
No, yung sinabi nga ni Doktora, pinag-uusapan natin ngayon, dapat siguro at a certain age ng bata, whether they have it or you don't,
You
wala
should
silang
recommend a
problema.
certain screening
Oo.
test.
I think 3 years old is good.
I think the
Once
schools
na 3 ka na, or actually even 2, basta, yung, minsan kasi ang problem with kids, it's so hard to test them.
Because
Iiyak yan
they
sa
have-
clinic eh. Pero once na yung bata na convince mo,
Oh.
basahin mo yan, tapos nabasa niya, more or less you would know na kung meron siya refractive error or not. Kung meron siya, you can correct that.
Saka isa pa dapat ituro yan, ha? Hindi porke na yung mga parents, kailangan, saka yung mga teachers, huwag natin panakot yung mga doktor, mga dentista.
Wag po.
Sa mga bata, para nang sa gayon, pag dinadala natin, hindi tayo nagkakaroon ng problema, di ba?
Opo. Kasi minsan, like us, darating na, eka malikot. Injectionan na kami ng doktor. Like
Hindi naman po
ophthalmologist po, hindi
nag-i-injection
kami
ng mga
nag-i-injection.
eye doctor,
Mga eye doctors po, hindi kami nag-i-injection.
Walang injection. Unless maoperahan, pero most of the time,
Hindi po.
basa-basa lang sila.
Anyway, we're gonna have a short break, ladies. This is very interesting. Lalong-lalo na, marami akong alam dahil galing po ako dyan. Kahit nakasalamin ako, pampapogi na lang ng konti ito.
Kahit wala pong salamin yan, makakita niya. Pero, pampagwapo.
Hindi, tsaka yung ilaw eh.
English.
Do you recommend ba dito sa Pinatubo area that we invest sa mga sunglasses daw? Doc?
For
Dito
protection,
for
because
protection.
parang
Yung sa
we're
glare,
in the
sa...
Pinatubo area,
sa-
so
Oh yeah. I recommend. I recommend na pag lumalabas tayo, almost
Yun.
everybody should have sunglass. Yeah, kasi
Hindi yung-
hindi lang siya
especially
aesthetic,
now.
di ba? Hindi lang siya for
no.
aesthetic
No.
purpose. Eh.
Hindi.
Hindi yung binili sa ano ha, kahit saan-saan lang ha.
Oh.
Baka-
Kasi yung sunlight, ultraviolet yan. It can cause early cataract. no?
Okay.
So if you wear glasses all the time, it prevents you from developing cataract early.
Protection.
Okay? Yeah. And plus yung dryness.
Okay. Oh, mag-break na muna tayo. Babalikan natin yan. Ganda-ganda ho ng discussion. Very interesting. I hope you young people who are watching us right now will talk and their parents, magpag-usapan nila ho to, mga kaibigan. At magpunta na kagad sa mga doktor kahit hindi pa nga ho kailangan na o wala silang nakikita na sintomas na kailangan po ng salamin ang kanilang mga anak. Babalik po kami.